typically be patients that would buy their own INR machine and who were very motivated to self-test. And they would then do their monitoring at home, and they would contact the doctor by phone to give them their reading, or the nurse, and they would then be dosed over the telephone. So there would be a telephone call involved, and often we would then send them the dosing diary over the post, really. My main concern about setting Engage up for patients was it going to be too complicated? I'm not a particular computer wizard, but I was wondering how simple or how difficult it would be. The main concern as a prescriber, I think, is when you allow patients to self-test their INRs, is usually that you lose control about the prescribing, and you can sometimes wonder a bit about what patients are doing. Are they actually checking their warfarin and their INRs regularly? So it's that loss of control that can be a little bit worrying as a prescriber, I think. The Engage app can help minimize that loss of control, because there's the app will transfer the results electronically straight away, and the app will remind patients of when to take their warfarin doses and when their testing is due. So there's an element of control. Integrating the Engage app with the INRstar will help my patients in different ways. It'll make the dosing of patients much easier, where the automatic transfer of the results makes the dosing much easier, and also the app will remind patients when to do their dosing and so on. So it'll be easier for patients. We will have less missed doses of warfarin. And for my clinic, there'll be less patients coming into clinic, and as a healthcare professional, you can dose patients in your own time, and that'll be useful. I think it's important to offer patients the option to self-test their INR, because I think given the choice, many people would opt to self-test. It really is about offering choice to patients, I think. There needs to be a formal training program for patients that are self-testing to ensure that they've got the right amount of knowledge and skills to do the self-testing, to make sure that they're not just being irresponsible about the testing. But I think the Engage app is helping with that, because the Engage app has got that formal training program built into it, and patients cannot actually get on the Engage program until they've done their test and the training program. Yeah. Oh yes, definitely, and I think it's definitely the way forward, I think. I can imagine that it's following regulations and guidelines with regard to setting up formal training programs, and again, that loss of control that you get with regard to the prescribing. It has been surprisingly easy, really. I think patients are quite sort of computer savvy, really. Even a lot of the elderly patients have got tablets and smartphones these days, so explaining it to patients has been quite easy. I like the fact that it gives freedom both for the healthcare professional but also for the patient. The patient stays in control and can don't have to come into the surgery. It offers them some freedom, and I quite like that about it. Yeah, I most certainly would continue to promote the use of the Engage system. I would say to healthcare professionals and practices that are considering offering self-testing to patients that it is really in the patient's interest, and there's no reason why it can't work, really. Oh, there must definitely be a cost saving here. If we can get more patients onto self-testing, there'll be less need for running regular clinics. And it's just the flexibility that it offers, both for the practice and for the patients, really.
My name is Bernadette Cahill and I am assistant practitioner in cardiology, and I like to think that I run this single-handedly, but of course I don't, but I am the control freak behind the computer. I think it makes it easier for them. They have control, they see it. It's not just me saying, oh, that's the number. I think it's they have the control rather than me. Yes, I love it. I keep offering it to everybody. Yes, yeah. Once I found the self-care tab, yeah, that was fine. Yeah, no worries. It's just the confidence, I think, and everybody's individual. So I think once they've got the fundamental part down, coming in to see that the person who they trust to go through the rest, then I think that's good. To go for it. It's easy. I can do it, so I'm sure anybody can do it. It is easy. There's no errors. You can, especially when you're sending texts and you send it, you think I haven't spelled that right, or there's always room for error. Whereas this, there is no room for error. It does it. It all talks to itself. It's a lot more. It's better. It's safety conscious. I'll be able to offer it to a lot more people because of the fact that it just pops up into my INRstar, and of course I check every day that when it says tests. So I think that will be a better option than me having to remember to email everybody that should be due and then wait for them to get back to me a week later. What do I like the most? I think because the patients do have control, there's a lot of patient satisfaction, and I'm all about that. I'm all about giving the patients and having different things. So self-testing might not be for some people. Some people might like to just come in and see you that once a month or whatever. So I think the tailor making it to the person is the good